Good morning, everyone. Happy April Fool's Day. It's April 1st here. I just wanted to say thank you for joining us, whether you're on our Zoom call or you're watching on Facebook Live or you're watching after the event. And we will kick off the York County Community Sector Briefing with Laura McDougall, the Executive Director with Four Corners Health Department. Laura, it's yours.
Thanks, Lisa. Welcome everyone this morning. Glad to see you all this morning. We are, I'd like to first talk a little bit about the cases and that we've been seeing. You may have noticed that we went up in case counts just over the past week. But the good news is I think we're going to go back down. This week's going to look better than last week. So we've had a pretty quiet weekend, and we have also, unless we have a really, really huge day today, our case counts should be kind of heading back down in the downward direction. So that's good news. We did have, over the past couple days, we had 9 new cases. We did have a quiet weekend though. We had 11 on Monday. So that was our big day. Our case counts have ranged from 1 to 13 cases each day in the last week. We've had 42 in the past 7 days. And, but I do want to also mention that York County had only 6 cases in the past 7 days. So that is, our high number was 25 out of Seward County. So York County is actually doing pretty well. We like to see those low numbers. And we're going to be redoing our risk dial again today, and that's based on just the last 7 days. So it had gone up to 1.83 as we said it last week. So when we said it this week, it should hopefully, we're not going to have any data that's going to throw it in the upward direction again. So I think that's good news. To talk a little bit about vaccines, and I know that the hospital always has a very robust report on that, so I don't want to dwell too much on it, but we do have numbers on vaccines, and I think this is something to be very proud of. We have in the last as of this morning, I had my staff figure this up. We have given that 56% of our 18 and over population have received at least a first dose. So that's 56%. That's over half of our 18 and above population have received at least 1 dose. And we have, in our district, we've only had available to us the vaccines to vaccinate the 18 and older. So, but 21%, so over 20% of our 18 and over population are fully vaccinated. So that means they've received either the 2 Moderna vaccinations, the series of 2, or the Johnson & Johnson vaccine to be fully vaccinated. So I think that's really good news. And here's a couple more things. Over 65 age group, the percentage of our over 65 population that have received at least 1 dose of vaccine is 91%. So that is really good news. And in terms of being fully vaccinated, so they, again, either the series of 2 Moderna or the Johnson & Johnson or Pfizer, because we did have some, our nursing homes did receive some Pfizer vaccine, as early on as part of the pharmacy program. But we have over 65 population fully vaccinated is 61%. So, I think we're definitely trending in the right direction. That's good news. In our district, we've had total of, we're coming up on 20,000 vaccines given. So we're at 19,056 total vaccines given. And I think you'll be glad to hear Jim is going to be talking about, the big, massive clinic they're having out at Holtis today. And he'll have to tell us if it's a record breaker or not this week. But you know, these numbers, we're having a real lots of large clinics this week, and that's also very good news for us. So what is the plan moving forward? And I wanted to kind of explain where we're at. We this week are trying to really focus on the 50 to 64-year-olds in the clinics that have happened this week to get them vaccinated, at least get their first doses in. And then we're going to also be looking at doing the 18 and older next week. So we are filling in some of our clinics that if we have open slots, we've even had to dip down into the under 50-year-olds this week in some of our areas. But next week, we're going to be solidly looking at, you know, it's pretty much wide open starting next week for anybody who's 18 and older in our district to register on that vaccinate.ne.gov and receive a vaccine. So please share that with everyone. We really want to make sure that that information is getting out there to go and register. Now's the time. We know that we're going to be really busy trying to get everyone that we can vaccinated in the next month. So please refer people to that website to register. We're going to be using that. Now, I did want to take a moment and talk about two things that yesterday that I had put out on news releases that are, you know, they're both some very serious issues. We did have one death that I released yesterday, and that's a recent death in the Four Corners district that was in Seward County. And in the Four Corners district, I also we put out a press release as well, as did the state, about a resident that is someone in our district who had a very serious, significant medical event following a vaccination. And it's something that and actually in the state's press release, they did put out that this is a person who is a healthcare worker. And, you know, first of all, I think this has been very serious and very, very hard on all of us as this has happened. We do, as the protocol in these types of situations is that we go and we do report what has happened through the vaccine, the VAERS system, which is the Vaccine Adverse Event Reporting System. So and this is a national system that is in place. The CDC, it allows the CDC to come in and do a very thorough investigation of what has happened. And so we don't, you know, this investigation is going to take some time to complete. And, but what we do know is that about a week after this individual was vaccinated, they did experience a very significant medical event. And this person was someone who, you know, dedicated their life to saving other people's lives. And I think that, you know, this has touched us all very deeply. We are going to be finding anything that we do find out as they do this investigation, and there'll be, you know, multiple levels of national, state, local information being fed into this investigation. But we will make sure that whatever comes of it is shared with with everyone. And with this investigation too, you know, this is very much a routine protocol that's done. And we still, you know that there have been a great deal of vaccinations done across the United States. And this happened after this person received a Moderna vaccination, which is what we're giving in our district right now, as well as we hope to have some Johnson & Johnson again too in the future. But you know, I just to keep in mind as we move forward, there have not been any major contraindications at this point of this vaccine. And in Nebraska, over 405,000 Moderna vaccinations have been administered without any major incidents. So, and we still have great confidence in this vaccine. And we know, especially after we've been at it now for a while, that we can see that that we have had many fewer cases in the older population and in populations and many fewer cases across Nebraska since we've begun vaccinating. And we know that the vaccine is saving lives. So, you know, at this point, we're going to monitor this and review it and share any findings with you. But this will take a little time. And I see we do have a question in the chat from Melanie. Can you tell us more about the significant medical event being investigating regarding a vaccination in the health district? So I think I hope I've shared. I feel like I've shared about as much as I can at this point. There are, you know, this investigation is looking into all the different factors that might have played a role in what has happened. So, you know, like I said, we'll make sure that whatever the findings come out of this, that they'll be shared. And definitely, we do want to address any safety concerns that might be found around the use of the vaccine, if that is in fact the case. So, okay, I think with that, I'm going to go ahead and finish up. So, Lisa, that was, I think, all that I have this morning. Thanks.
Thank you very much, Laura. We appreciate the update there.